I'm Dr. Gazelli's physician assistant and second pair of hands in surgery. You are about to have a cervical total disc replacement, and today I'm going to walk you through the procedure and recovery time from start to finish. Please feel free to take notes. I'm happy to answer any questions that you have or go into any more details with you in person. This is not meant to be comprehensive, so I do expect that you'll have questions, but hopefully it gives you a good amount of information about the procedure, the day of surgery, and the recovery time, and the whole process. In the pre-op holding area before surgery, you'll be brought back, and the nurses will start IVs and get everything prepped and ready. They'll also get all medical information and medications current in the computer and in the system. You will also meet the anesthesiologist before surgery in the pre-op holding area. Sometimes they even call you the day before surgery. So if you get a call that day before from a number you don't recognize, you may want to pick it up because it could be that anesthesiologist just trying to get to know you a little bit and chat with you. You of course will see Dr. Gazelli in pre-op as well, and he can answer any final questions that you have at that time. As far as the approximate time of the procedure and what your family should expect, typically a one-level cervical total disc replacement should take us about an hour and a half, and a two-level disc replacement should take us about 2 hours. We are always happy to keep all of your family or friends, whoever's there with you that day, up to date and informed on how things are going. The nurse in the OR can call them throughout the procedure, and Dr. Gazelli will call and go see them after the procedure as well. If they're there at the facility, he's happy to sit down with them face to face and talk to them. If for some reason they aren't at the facility and can't be there, that's okay. He's happy to call them on the phone as well, so he can keep them informed on how everything went and what to expect. As far as what happens in the OR, you've probably already watched the procedure video, so you know a bit about the procedure itself, but this is just a brief recap of the procedure and some of the commonly asked questions that people have. The procedure is done with general anesthesia, and we actually will have people in there monitoring your nerves and spinal cord during surgery. So after you're asleep, they're going to put little baby needles all over from head to foot, and that monitors the nerves and watches the spinal cord throughout the procedure. So if anything starts acting abnormally, they'll let Dr. Gazelli know right away. So I also mentioned them, however, because if you wake up with pinpricks, bruises, or bleeding, that's what that was from. Just want to warn you ahead of time. The incision that we make is typically always on the left side of the front of your neck. There's no big muscles to cut through here. There's a small thin muscle we go through, but no big muscles, which helps keep this procedure not very painful. So once we go through that small thin muscle, then we just get down, move everything aside to get down to the spine. And once we're down to the spine, we'll bring a microscope in so that both he and I can see everything nice and clear and big. We then remove all bone spurs, disc material, and anything that's pressing on the spinal cord or spinal nerves. And we'll always open up both sides, the left and the right. Even if your symptoms are more left-sided or right-sided, we will open up the nerve canals on both sides. Once we do that, once we remove and open up those spaces, then we'll go ahead and put the artificial disc in that fits best for your disc space. And then once that's placed, the surgery's done, and we'll go ahead and close the incision. Typically the incision is closed with all dissolvable stitches. There'll be a few layers of stitches there. That top layer is also a dissolvable stitch, but I don't like putting the big thick knots underneath the thin skin of your neck, so I'll actually leave a little tail end on either side and then secure that with a steri strip or one of those white skin tapes. So you'll see that on there, and that you can just leave alone. There'll be a gauze bandage over that as well. And then once the incision is closed and bandaged, then we will put a collar on and you will wake up in a soft collar that day. You'll then go to the recovery room, and the nurses there will watch you as you're waking up, making sure that you're waking up okay, controlling the pain that you have, and watching your swallowing as well. They do definitely watch the swallowing because we're going to be working in the front of your neck and around your throat. So initially, we only let the nurses give you liquids at first because we want to make sure that you can swallow those okay. After that, you'll step it up to soft, regular food. But because the surgery is done in the front of the neck, we expect that you're going to have a lump in there, a little swelling from surgery, and feel like there's a lump when you swallow, which is why we watch the swallowing closely and only have liquids at first. We also may have put a drain in after the surgery, and if that is the case, the nurses will watch that drain in the recovery room and just making sure to monitor how much drainage there is. As long as there's very little drainage, typically the drain is pulled before you go home that day. On occasion, a patient has gone home with that drain. If the drain is draining a little bit more than we're okay with you going, or okay with it being pulled, then we will send you home with the drain and you would just come back in the clinic the next day for us to pull it out. But typically these are able to be removed. As far as getting you home, once you're awake, your swallowing is okay, and the pain is relatively controlled, they will discharge you. They'll make sure you're getting up and walking okay as well, of course, but then the nurses can discharge you to home. You'll also be going home with pain medications and muscle relaxants to help cover any discomfort from pain as well as muscle spasms. Typically, we try to give these to you in your pre-op consent visit so that you can fill those ahead of time. So hopefully you'll have those for you at home and don't need to fill them the day of surgery. We do give you antibiotics during the surgery, so we do not send you home with antibiotics. So it should typically just be the pain medicine and muscle relaxant that you should have at home for yourself. Typically, this is an outpatient procedure and you should go home the same day of surgery from the recovery room. If for some reason you stayed the night at Rose Medical Center, we do have a spine and orthopedic floor that you'll stay at, and there are nurses and physician assistants that work there, and they'll be taking care of you. They are working on that spine and orthopedic floor, so they know how to care for the patients and know what Dr. Gazzelli likes done with his patients. The physical therapist and occupational therapist will also be working with you on just daily activities, getting in and out of bed or in and out of a chair, that type of thing, while you're there if you do end up spending the night again. You're going to be in a gown most of the time, but you can definitely bring loose fit, comfortable clothing to go home in, whether you stay the night or go home that same day, of course. You're also welcome to bring any toiletries or anything from home that you wish to if you do end up spending the night there. At Rose Medical Center, they are all private rooms, so there won't be any rooms that you'll have a roommate or anything like that. And while you're there, if you do end up spending the night, you will see Dr. Gazzelli or myself on a daily basis. If for some reason you were there on the weekend, you would also see Dr. Gazzelli, myself, or whatever other surgeons or physician assistants that would be taking call that weekend and rounding on all of our inpatients. As far as what to expect initially and the restrictions that we ask that you follow, swallowing again is something we watch closely, and keeping a soft, regular diet initially. As I said before, it'll be liquids at first, and as long as you're swallowing liquids okay, you can advance it to a soft, regular diet, keeping it easy, such as soups, pastas, applesauce, pudding, yogurt, things that are easier to swallow, of course. Because as I said, you'll have that kind of golf ball sensation or lump in your throat initially, and that could just last a week or two and slowly get better with time. But that's just that normal initial post-op swelling that we would anticipate. So we want to make sure that you keep things softer and easier to swallow. And as you're tolerating swallowing more things, you can definitely step it up to regular food as you tolerate. You may also just want to keep a good glass of water or something to drink to flush down the food, or pills that might get stuck or something like that. So just watch that swallowing. As far as activity restrictions, walking is your main therapy and activity after surgery. We want you walking in alternating positions. I don't want you bedridden or I don't want you chair-ridden after this. Definitely getting up and moving around. If you're just hanging out at home watching TV or reading a book, I want you to get up every 45 minutes to an hour and just move around a little bit. If it's nice outside and you want to go for short little walks outside, you're welcome to. If you feel like just moving around your house, getting up, go to the bathroom, get a drink of water, or just walk laps in your home, that's fine as well. And as you're recovering and feeling more up to longer walks, you're welcome to advance it to longer, shorter walks throughout the day. But initially, definitely multiple little walks and not just one long walk. Listen to your body. If you're feeling more wiped out or sore after a walk or even the next day, just back it off a little bit and don't try to push through or advance too quickly. I mentioned earlier that you're going to have a soft collar when you wake up, Initially, that first week, we do ask that you wear it pretty much all of the time. And nighttime is actually the most important time to wear it, when you can get your head in a funny position and you're not really conscious of what position you're getting your head or neck into. And after that first week, after that first post-op visit, we'll tell you you can just wear it as needed during the day. Because it's a total disc replacement, we typically are not that strict with the collar, and we do allow you to move your neck a little bit more and wear the collar for comfort during the day, but you may still want to wear it at night initially just to protect your neck during sleeping. And as far as showering and wound care goes, I mentioned earlier that you'll have that white skin tape or steri strip on the incision, and all of that can get wet in the shower. So you can shower the second day after surgery, so about 48 hours after surgery. And when it comes to that time, and then daily after that, you can take the outer gauze bandage off and shower like normal, washing your hair, letting that soapy water trickle over your neck and over the wound. As I said, the steri strip can get wet, that's fine. Just don't let the water pound on the incision, don't scrub the incision, and don't let it soak under a bath or a pool, of course. Once you're done with the shower, you just pat it dry, and you can then put a new gauze bandage on, and then the collar if you're wearing the collar at that time. Just keep it clean and dry, no ointments, lotions, creams, nothing like that on it. Just keep the incision clean and dry, of course. With the pain medications and sometimes the muscle relaxants and the medications you receive during the anesthesia and the procedure itself, they can actually slow down your belly a bit and cause some constipation. So we typically do recommend that you stay on a stool softener for as long as you're taking a narcotic. If the stool softener if the stool softener alone is not enough, then definitely step it up to laxatives if needed. Of course, to step back or stop all of that if you were to go the opposite direction and started getting diarrhea. But definitely the narcotics can cause constipation, so staying with those stool softeners can be helpful to try to limit or avoid that. As far as driving goes, that we do ask that you not drive as the driver for the first few days, if not up to that first week. Because of the general anesthesia, the stronger meds that you got during the surgery, and even if you're using narcotics after surgery when you're at home, you really shouldn't be behind the wheel, and we don't want you to be driving. You could ride as the passenger, of course, whenever you would like to, but not as the driver. We'll talk about getting you advanced to driving, usually at that first post-op visit, if you're able to hold off on driving up until that point. As far as work goes, typically people who have office-type jobs can get back to work within the first week or so. If you have, we do want you to take some time off, and like I said, you can get back to work within the first week or two or sooner if you have a sedentary office-type position. Typically, regardless of when you go back to work, whether it's a few days later, a week later, 3 weeks later, we do recommend that you typically try to go back part days. Because of the anesthesia and all the stronger meds that we typically have you on or have given you, you can get really wiped out pretty easily. And so they're typically going back for a full 8 to 10 hour day within that first week, or whenever you do go back, can be too much for you and you just get extra tired and sore. So if you have capabilities of going back part-time for that first week back to work, that's usually beneficial for patients. And you obviously can work from home whenever you feel clear enough in your head and ready to. There's no restriction with that. For those of you who have a little bit higher physically demanding job, your usual time out of work is going to be longer, because typically we will not clear you for really physical work until we get you through physical therapy. So it can be 2 to 3 months until you're cleared for full duty on a real physical job like construction workers or a job similar to that. Like I said before, office type work, people can get back usually within that first week or two. As far as complications and things to watch for with that, again, I'm going to talk about swallowing difficulties. That's obviously one of the number one things we watch. If people at home are noticing that they're having a tougher time swallowing or limited more in what they can swallow, we definitely want to know about that. So please let us know if your swallowing is worsening. You may notice some voice changes or hoarseness initially because of the approach that we have in working in the front of your neck around the nerves that control your vocal cords. So you won't be alarmed if you get some of that, and that should get better with time as well. Some people notice it and some people don't. The incision itself, you may have a little bit of incisional pain or some numbness around the incision, but typically the front of the neck is not that painful. The most noticeable post-operative pain with this procedure is in the back of the neck, kind of back of the neck, upper back, shoulder region. And that's because we stretch the nerve or the joints and the muscles a bit when we're doing the surgery and getting that artificial disc placed in there. So that's the typical post-op pain you should anticipate, and that's why we give you the pain medicines, and even the muscle relaxants can be more beneficial because it is more muscular type pain in the back of your neck and upper back area. You're welcome to use heat or ice in the back of your neck as well. There's no problem with that. If you're noticing any persistent weakness, pain, numbness, tingling in the arms, some of that is completely normal. Once we take the pressure off the nerves during the surgery, now the nerves need to heal. And unfortunately, they do heal slowly at times. So I always tell people our expectation is that you should have improvement of your symptoms. Some people notice that they're completely resolved, but others notice that they're better, but not fully gone right away. And that is totally normal. Hopefully you have less frequent or less severe pain or symptoms in general, but it's okay if there's a little bit of that coming and going as far as tingling, numbness, pain. If you have weakness in your arms or hands, that can persist a bit, and it will get better with time. But like I said, the nerves heal slowly, so we just need to give them time to heal. Also, on occasion, a nerve will get a little aggravated that we were even in there operating around it. Normally, the spinal nerves don't mind too much that we were in there, but on occasion they do. So a patient could wake up with some increased or similar symptoms than what they had prior to surgery. If you had the same level or increased level of symptoms, we can calm down that acute inflammation with some medications and try to get that to ease up a bit for you. There is one nerve in particular that's a little bit more temperamental than others. The C5 nerve, which actually comes out at the C4-5 level, is more easily irritated during surgery. So if you are having surgery at C4-5, there is a higher chance you could have a little nerve irritation from surgery, and people can wake up with what we call a C5 nerve palsy, where they have difficulty and weakness more so with that nerve, and that would give you shoulder weakness and bicep weakness in lifting your arm or lifting things with the bicep. If that were to happen, we will watch you closely and we will use medications to calm down that inflammation and stabilize that nerve to get it to heal. The other thing people worry about is paralysis. We are operating around the spinal cord, and we do bring a microscope in, like I said, and we will have people in there monitoring the nerves throughout the surgery. So we do make sure that we can keep everything nice and clear for us to see and decrease any chance of paralysis. We're very meticulous when we work and slow when we work around the spinal cord. So there's a very low chance of that as well. The other thing we always like to talk about, and you will see on your consent form, that there's always the possibility that we cannot get the artificial disc placed appropriately, or it doesn't fit correctly, I should say, in the disc space. And we have had to convert an artificial disc to a fusion. This is not very common. We're very good about getting the disc mobilized and being able to place that artificial disc, but on a rare occasion, a total disc has had to be converted to a fusion. So we always have them, the fusion bone graft and plate and screws on backup in the operating room. So there's always that chance you could wake up with a fusion, but like I said, it's usually pretty rare that we have to do that. As far as when to call us to let us know what is going on, definitely changes in strength, increased weakness we want to know about, increasing pain, numbness, or tingling that is not calming down, we definitely want to know about. As I said before, you may still have some symptoms after surgery, and that's okay. As long as it's less severe and less constant, you may even have some days that are better than others. Some days you just feel it more than others. And as long as it's just that up and down, some days better than others, but overall getting better, well, that's okay. But if you're having increasing symptoms, definitely let us know, give us a call, and we can chat about that, of course. If you're having any persistent fevers or other signs of infections around the incision, let us know that as well. Usually the anterior cervical approaches has a very low risk for infection, but definitely let us know if you're having any concerns with that. Persistent nausea and vomiting, also let us know. We can work with that with anti-nausea medications. Sometimes the pain medications can definitely give people a little stomach trouble. Also, again, we'll talk about swallowing. Any worsening swallowing, let us know as well. As far as when you'll see us next, we typically see you for your first post-op about 7 to 10 days after surgery. At that visit, we remove any sutures and steri-strip that are there. We'll get x-rays, review how you're doing, answer all questions, go over your x-rays with you. And after that appointment, we typically do feel that people can drive after that time if you haven't already started driving. Usually the biggest hang-up at that point is narcotics, but in most cases after that first week, even after sometimes a few days, people don't need the narcotics. This typically is not that painful of a procedure. So once you're not taking the narcotics during the day, we typically will clear you to drive. And the rule of thumb with driving is that you will actually drive with your collar off. So if you're still wearing it during the day at all, you will drive with it off so that you can check your blind spot or move your head to check the areas around you if necessary. We'll then see you again about 6 weeks after surgery, and at that time we would transition out of the collar altogether if you're still wearing it, and then we will also start physical therapy, and we'll give you an order for that to get that started. We then like to see you back at about 6 months and then 1 year after surgery. So we will get x-rays every visit to monitor the disc and to check the adjacent levels and just keep an eye on things. As far as getting back to normal, at about that 6-week mark, like I said, at that post-op appointment, we will start you in physical therapy for strengthening and stabilization of your neck. We'll give you that order and help you set that up if necessary. You can also then gradually increase your activities in conjunction with your physical therapy. And as you're getting stronger, you can just move ahead to normal activities. Typically within that first 6 weeks prior to starting physical therapy, we usually want you to limit your lifting to no more than about 10 pounds and a lot of overhead activity. And then as you start physical therapy, you can start gradually increasing your normal activities, and they can help guide you to get back into your normal exercise routine or sports or physical activities that you enjoy doing. So hopefully this has given you a good amount of information on the procedure. Like I said, I'm happy to sit down face to face and go over further questions or details with you.